So now we will use the Darvin. The Darvin we will using we have three sizes of Darvin. We have the 30 ml, we have the 30 mm, and we have the 50 mm, and we have the 70 mm. Depending on the case and the size of the face where you're going to use. So for example, for the forehead, for this patient, I will use the 30 and the 50. I will use the 50 horizontal and the 30 vertical way. So if we are using for the face, for example, for the nasolabial line, if you want to assist it, for example, you did some gel for the deep nasolabial line, but the patient still have a folding, you can use also the Darvin in that area. No, it's okay. فقط alcohol swabs and ice, because I need too much, huh? So you can just take the ice and put it here and remove it when I say to you. Or you can just, okay? So I'm taking this part. Here I have two line, but it's not that deep line. So that means I will start only from this side to this side. I will not take it too much further. So first I will do the horizontal Darvin, which I will be using the 50. No, 50. Give me 50 first. You can just put the ice. You can count to 10. The area, it will be enough frozen to start put your Darvin. So, Doctor, thank you for your assistance. It's an honor to stand with you, you know. Okay. So just swap and go ahead. So I will have like 5. I will go for deep tissue. So you don't take it very superficial. No, deep dermis. Yes. Don't take it superficial. Okay? So you just take it 45 degree and you penetrate like 1 millimeter almost, or less than 1 millimeter, and then you guys go straight. So be sure that the thread you are passing, you know the end of the needle. That means this is the end of the thread. Okay? So that's why when you do your marking, it will be very good, so you know where you are putting the threads. And you can put just between one and the second thread around, let's say, 5 to 10, depends, 5 to 10 millimeters distance. It depends on the size. Okay, so the thread is 6-0, so it's very fine. Okay. Here, in this area, no. So, I think is enough to up. I will just put one more down here, so you can just okay. So now I have the 5 needles. Now I will finish this side and then. Okay. So how I have to remove it is very important. So I have a small gauze. Okay. It's the same technique as you are using the PDO. Okay. The only difference is that is PDO. That's caprolactone. So that means the effect and the healing process and the fibrosis creation is very fast and long term. That means the thread will be absorbed between 3 to 6 months. It will be totally absorbed, but the lasting, it can be more than 2 years depending on the patient tissue. Okay? More vitalization, yes. Okay, so press on the end of the needle, press and take it up this way. Don't take it that way, because you need to make sure that the thread is still inside. And you can look at the needle, you find that your thread is totally inside. Sometimes you take it out, but the thread is still here. You didn't leave it. And it happens sometimes, okay? So press, and leave it this way. Okay? You see how is the needle curved?
It's okay.
You're okay? Some pain? Okay. Little pain. You can handle it, right? It's just a minimal. Okay?
Okay.
30 ml. So we are going the opposite way. Cross of that one, of the first.
دستتو باز کن. نفس عمیق بکش.
Pain. Okay. Finish. Yes. You're okay now?
میخوای یه ذره وایسته.
Finish. Okay. Yes. Stop. Okay. So you can remove it very fast now. We remove it. Okay. I will.
بسیار درم دردناک هست. حتما زایلوپی استفاده بکنید.
Okay.
در واقع درم میشن به
So.
ماست داخل درم میرن جلو و میکشن نخ داخل درم میمونه فایبروسیس رو تحریک میکنه.
The right side, which we had the Darvin, you can see the line, it become less visible than the left side. Can you take side? So we will do it a little bit quickly. We can adjust the. So first one, any pain now? Less pain, right? Okay. Second one. Okay, you are fine. Good. So this is the last one. Yeah, because you know what's the difference between the woman and the man in Iran? The woman kill me and make me beautiful, so that's
very sensitive for me.
yeah. So again,
So sensitive.
remove. Okay. So pushing.
عمیق بکش ببینم. عمیق. نفس تو حبس نکن.
Okay. So push. Remove it vertical way. Okay. So sorry. Again. Thank you. Again. Thank you. Again. Thank you. So let's go to the other side.
بهتر شدی دیگه نه؟ الان درد که نداری.
Okay.
آخه اینجا مال شما احتمالا خارج از برنامه بوده.
Usually I use ice, not all patients I use anesthesia for them, but usually I use ice. Even if I want to inject a gel, I use ice. So again, we push, okay, and remove. Secondly, I use ice. Okay. من خیلی عالی. So now the procedure is finished, and you can see the results. You can see the line is less, is reduced, is very light. Of course, by time, let's say 1 to 3 weeks, you can see very more light, and the line is totally disappeared. So if you want to add in the middle, also you can add in the middle, also cross, same way, and the patient is very satisfied after that. So.